Right. So if you have read and understood, considering its surgical and optimization, kindly tell me what structure are you looking at?
You're seeing the back of the leg with including the popliteal fossa and
All
part of
right.
the back of the thigh and
Can
leg.
you please tell me what are the boundaries of the popliteal fossa?
Popliteal fossa is bounded above by the medially by semimembranosus and semitendinosus, laterally by biceps femoris, and uh, at above and below it's medially bounded by medial head of the gastrocnemius and laterally by lateral head of gastrocnemius.
Very good. Can you please tell me the contents of the popliteal fossa from superficial to deep?
From superficial to deep, there is a tibial nerve, tibial and tibial vein, and tibial artery. Yes, popliteal artery, tibial nerve, popliteal vein, and
What about
popliteal
the
artery.
common peroneal nerve? Where does it lie?
Yes, it's most superficial. Yeah,
Yes. And
laterally.
then tibial nerve, then popliteal vein, and then popliteal artery, and then lymph nodes as well. All right.
Popliteal.
Okay. Can you please tell me at what point would you feel the popliteal pulse?
It's the above just against the popliteal fossa
Yes.
at the midpoint of two
Midpoint.
condyle,
Yes.
tibial condyle.
What would be the position of the leg? You'll semi-flex.
The leg should be bent
Yes.
and the hand and the
Both
two
hands.
hand
Both hands.
hand
Yes.
both hands. The thumb should be on the patella, and we should
Yes.
feel with the fingers
Yes.
behind.
All right. Just suppose there is a lump in the popliteal fossa. What are the differential diagnosis that you will consider?
It could be popliteal artery aneurysm. It could be Baker's cyst, lipoma,
Yes.
any neural tissue uh, tumor like
Schwannoma. Yes.
schwannoma. Yes,
There could even be a popliteal vein varicosities. All right.
yes.
Can you please tell me if you can identify this number 11 and kindly tell
This
me
is
the origin and
semimembranosus.
yes.
Semimembranosus is originate from gluteal ischial tuberosity
Yes.
and inserted into semimembranous, inserted into the medial surface of the tibia.
Yes. All right. Can you please tell me where does the iliotibial tract attaches?
Tibial tract attaches anticipate iliac spine to the medial side of the tibia.
Okay, anterolateral
Iliac
iliotubercle of iliac crest to lateral condyle of the tibia. All right.
tibia.
Can you please tell me what are the muscles which insert into it?
Muscles into the iliotibial tract, the gluteus maximus and tensor fascia lata.
Very good. What is the clinical significance of iliotibial tract?
It helps strengthening the strengthening the lower limb while walking and running, and lateral stabilizer of the
Knee
knee
joint.
joint.
Yes. All right. Can you please tell me what are the joints and ligaments which stabilizes the knee joint?
Ligaments, there are anterior cruciate ligament, posterior cruciate ligament, and meniscus, medial meniscus, lateral meniscus, and there are anterior collateral ligament, medial and lateral collateral ligaments.
All right. Can you please identify what are you looking at in picture A? Which view is
Picture,
it? Oh, sorry,
picture
on the left-hand side. This picture on
is
the
the
left-hand side,
lateral
yes,
surface of the lower leg.
of the lower limb. All right. Can you identify number A, please?
Patella,
Not exactly.
no,
Okay. What
oh,
is B?
mm,
White. It is white, so it can't be.
is the
Okay.
fascia,
Okay. C. Can you please tell me?
extensor retinaculum.
Very good. Can you tell me the attachment of extensor retinaculum?
On the leg, okay. Uh, no, I'll come back to it.
Okay. Can you identify structure D, please?
It's
Can you please name
It-
the structures which pass through the, this is lateral condyle. So
lateral
what are the
malleolus.
structures? Yes, lateral malleolus. What are the structures which pass through it?
Behind lateral malleolus, there is saphenous. There is sural nerve and short saphenous vein
And any other
and
structures? Okay, we'll come back to that later. Can you please tell me how many compartments there are in the leg?
Yes, there are anterior and posterior and lateral compartment.
Yes.
Anterior, posteriorly, there is again superficial and deep compartment.
Okay. Can you tell me the contents or the muscles in each compartment, please?
Yes, there is anteriorly there is uh, tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius.
And
Laterally there
okay,
is peroneus brevis and peroneus
tibialis anterior as well is in anterior compartment.
tibialis anterior. Yes.
Yes. Okay. The content of lateral compartment, please.
There is tibialis, peroneus longus and peroneus
Brevis.
brevis.
All right.
And
Can you now tell
posteriorly,
me, yes, please, muscles of the superficial posterior group?
yes, superficially there is tibialis posterior, flexor hallucis longus, flexor digitorum longus. Superficially
No.
there is gastrocnemius, soleus, and
Yes.
plantaris.
Yes.
And
the deep?
deep there is
Pop-
tibialis posterior, flexor
Yes.
hallucis longus, flexor digitorum longus, and
The popliteal.
yes.
Yes. Okay. Can you please tell me the nerve supply of the dorsum of the foot?
Dorsum of the foot is supplied by superficial peroneal nerve, except the first wave space, which is supplied by deep peroneal nerve.
Deep peroneal nerve. And sural nerve supplies which part of the foot?
Sural nerve is the lateral edge of the foot.
Yes, very good. Okay. Can you tell me how would you, if I ask you to demonstrate the knee reflex, how would you do it?
Is that the leg should be unsupported and the knee, the thigh should be exposed.
Yes. And
It should be 90 degree. The
yes.
knee joint should be 90 degree.
Yes.
And we should
You'll
check
tendon the,
whether
yes.
the quadriceps muscles should.
What is the root
look at
value you're checking by confirming or
L3-4.
L3-4? Okay. Can you also tell me in which position? Okay, that I'll ask you again. Yeah, then when, okay, we'll do the ankle with the foot. Okay, later on. Right. So, right. If a patient presents to you with the tibiofibular fracture and there is swelling in the lower leg, how would you confirm which compartment of the leg is involved?
The passive movement of the foot will cause pain out of proportion
Yes.
of the opposite compartment. If
Yes.
there is pain out of proportion, if I do like dorsiflexion,
Yes.
and then there is pain, then the compartment syndrome would be on the posterior side. And if I do plantar flexion and there is pain out of proportion, there
Yes.
will be compartment syndrome of the anterior compartment.
All right. Okay. There is one last question. What action would you require to confirm the movement of tibialis anterior and tibialis posterior muscle together? What
Inversion.
movement would you? Yes, ankle inversion. Okay, very good. Because foot will cover some other day. All right. One last question. How would you confirm if if there is with injury there is involvement of common peroneal nerve?
How to confirm common peroneal
The
nerve injury?
involvement of, yes, involvement of common
There
peroneal
will be
nerve.
loss of eversion, ankle eversion, and sensory loss of the dorsum of the foot, except first wave space.
Dorsiflexion and eversion will be lost. and there'll be some foot drop
Yes.
also visible, and there'll be sensory loss over the dorsum of the foot.
Dorsum of the foot.
Yes. Compartment syndrome I've already asked you. So basically, all right. Basically, I've asked you all. All right. Good. Thank you. Oh, before we end, can you describe the image on the right-hand side? What kind of image is this? And what do you see?
It's a peripheral angiogram of the lower limb artery. Lower
Yes.
limb artery. This
Lower limb
is
vessels,
the
yes. And
is
A
the
is pointing at what, please?
A is the popliteal artery.
Yes, B.
B is the anterior tibial artery.
C, please.
C is the peroneal. C is the posterior tibial artery. D is the
D.
peroneal artery.
Very good. Okay, thank you so much. Right.
Thank you, ma'am.